Hello, my name is Matthew. I'll be your student physical therapist today. How are you doing?
Good.
So first thing we're going to do is I'm just going to ask you a few questions about, I heard you're experiencing some right ankle pain. Is that right?
Yeah.
Okay. Is that the reason why you're here today?
Yeah, I hurt my ankles.
Okay. Could you tell me how you injured it?
I was playing soccer and I tripped and I sprained it.
Yikes, that sounds like a rough injury you had there, huh?
Yeah.
This is the first time you've injured that ankle, or?
Yeah, it's the first time that
The
I
very
hurt
first
it.
time? Okay. Could you describe how that pain's feeling right now?
It's kind of warm, but it really aches when I try to move it.
It's warm and achy. Okay. So on a scale from 0 to 10, 0 being no pain, 10 being the worst pain imaginable, where would you rate your pain today?
Today it's probably like a 5.
About a 5?
Mm-hmm.
Okay, and then in the past 24 hours, on that same scale, what was the worst you would say it has been?
At night it gets a little closer to the 9.
At
Hurts
night?
pretty bad, yeah.
Does that pain ever wake you up at night?
No.
No, not at all? Okay. So on the same scale from 0 to 10, where would you say their pain is at its best?
It doesn't really hurt much at like a 3.
At a 3? Okay. So during what activities would you say make the pain at its worst? Makes it feel really bad?
If I'm trying to walk on it, it hurts really bad.
Are you using any crutches, or are you walking on it currently?
I'm not supposed to walk on it, but I was trying to on my own.
Okay. Did you see the doctor about it?
Yes.
You have?
Mhm.
Okay. So the pain's mostly when you start walking on it, correct?
Yeah.
Okay. And during what activities would you say make the pain go away?
If I keep it elevated and ice it a little, it doesn't hurt
Okay,
that
so
bad.
ice seems to help it a
Mhm.
great deal.
Yeah.
Okay, so how often, or about how long after you ice it or you put it to rest, does the pain go away?
It stays away as long as it's still cold, so like 5 minutes, I'd say.
Okay. Okay, so now I'm just going to ask you a few social history questions, okay? Could I ask you what you do for work?
I'm a realtor.
Okay. Has that pain interfered with your work at all?
Yeah, a little walking around showing houses, it's affected.
Walking around. So would you say the pain's worse when you're just walking around your job?
Yeah, definitely.
Okay. Do you have any like certain activities and hobbies you like to do?
I play with my kids a lot.
How old are your kids?
17.
17? Okay. So has your pain stopped you from, I guess, playing with your kids at all?
No, not really. I mean, it does hurt, as I said, putting weight on it, but we don't do anything too intense.
Is there any activities you would say that the ankle has been preventing you from doing?
Yeah, stairs are really hard.
Stairs are hard.
I have a ledge getting into my house that's kind of rough.
Okay.
Just putting weight on it.
You said there was a ledge at your house. Is your house 1 story? Is it 2 stories?
It's 3.
It's 3 stories.
Yeah.
So you kind of just stay on the first
Yeah,
floor.
I've been
and then-
sleeping on the couch the past couple days.
Oh, yikes. Is the couch any comfortable?
No, not too good.
Not really? No, I'm sorry to hear that. So I'm just going to ask you a few questions about your medical history, okay?
Mm-hmm.
Do you have any history of anything chronic, any chronic illness you have that I need to be aware of?
No, nothing.
Nothing?
No.
Nothing current? Okay. Any surgery in the past that you've had?
I had heart surgery.
You had heart surgery?
Yeah.
How long ago was that heart surgery?
10 years ago.
It was about 10 years ago?
Mhm.
Wow, how has your heart been since then?
Oh, it's great.
It's been doing
Good
great?
as new, yeah.
You haven't experiencing any symptoms since that heart surgery?
No.
No? It's good as new, huh?
It's good as new.
Awesome. Good to hear. So are you on any current medication?
I'm just taking some Tylenol for my ankle. It's about
Okay.
it.
So Tylenol for the pain in your ankle?
Yeah, the pain, yeah.
Okay. Is your physician aware of your Tylenol use right now?
I haven't told him, but
Okay. That's fine. Do you know what dosage amount you're taking?
I don't.
You don't? Okay. And do Do you just take it as needed, or do you take it daily?
I take it the recommended every 4 hours.
Okay. Okay, now I'm just going to ask you a few questions about your family history, okay?
Mm-hmm.
Any family history of hypertension?
Yes.
Yes. Could you tell me what family member?
My second cousin.
Your second cousin?
Mm-hmm.
Do you know if he's getting that treated at all?
He seems fine. He's taking medication. Yeah.
Oh, he's doing fine. Do you experience any high blood pressure, hypertension?
No, not that I'm aware of.
Okay. Any family history of cancer?
No.
No cancer. How about diabetes?
No.
No. Stroke?
No. No stroke.
And lastly, heart disease?
No.
No. Okay, perfect. Okay, I'm just gonna ask you a few social history questions. So do you consume any caffeine?
Not since the heart surgery.
Not since the heart surgery. No. Does the caffeine have a negative effect on your heart? Is that why you stopped using it?
Yeah, I haven't done it in 10 years, so.
Okay, that's good. Any tobacco use?
Nope.
Alcohol?
Never.
Okay, perfect. Okay, so could you tell me what your goals are for physical therapy?
I really just want to get walking on my ankle and it doesn't hurt anymore.
So walking without pain, would you say?
Yeah.
Perfect. I think we can get that done for you. Okay, that's all the questions I have for you today. Right now we're gonna continue with the evaluation part, okay?
All right.
We're just gonna listen to a few of your heart sounds, okay? There's 4 different heart sounds correlated with 4 different valves in your heart. And so 2 of those valves are correlated to one sound, and 2 of those sounds are correlated with the other sound, okay? So one is called the S1, and that is your closing of your tricuspid and your mitral valve, okay? The other sound is your S2, which is the closing of your aortic and pulmonary valve, okay? So like I said, there's 4 spaces. There's gonna be 1 on your right, which is in your second intercostal space, and there's 3 on your left, 1 in your second intercostal space and 2 in your fifth intercostal space, okay? Since you have your shirt off already, we're just gonna get started, okay? Okay, so I'm just gonna locate that one on the right first, okay? Okay, could I have you lift up your sports bra a little bit for me, please? Thank you. Awesome, thank you. All right, ma'am, we're just gonna listen to a few of your lung sounds today, okay? There's 7 on your front and then 10 on your back, okay? We wanna make sure there's nothing adventitious or abnormal, okay? Those would be sounds in your heart that we would be concerned about, okay? So there's 4 different kinds of sounds. We have crackles, which indicates there's maybe some secretions or mucus in your lungs, okay? There's also wheezes, which means there's a blockage of small pathways, and then blockage of those large pathways we would call stridor, okay? And then we just lastly want to make sure there's no inflammation, which is called pleural rub, okay? So we're just gonna check for those things, make sure you're doing okay, all right? Okay, so throughout the process, I need you to take some very deep breaths from you.
Patient faded.
Take a deep breath in. Would you lift off your sports bra for me a little bit? Thank you. Okay, ma'am, we're gonna listen to the back side of your lungs now, okay? I need you to take deep breaths in and out, okay?
All right.
Okay, man, what I'm gonna have you do is I'm gonna have you lay down. We're just gonna check your ABI, which is just a measurement to make sure that your blood is flowing throughout your body correctly, okay? We're just gonna apply your blood pressure cuff to both your arms and then onto your legs, okay? Okay, have you roll up your sleeve for me, please?
What did Tariq say? I knew he said something.
You're doing a voiceover.
Where's Tariq?
Is that comfortable for you?
Yes.
The patient is told that the blood pressure cuff will be applied to both their arms and their legs. The systolic blood pressure will be measured on each point. On the arms, gel is applied to the brachial pulse in which the PT is palpating.
You guys need me, I'll be in my office. Please feel free to come and ask questions.
So like, we don't have to do the whole like hydrate, calcium, blah blah blah. You just want us to be like, just explain.
Part should be your introduction, talk about, then follow the key points of the
No, I know. I'm just trying to figure out what you want. You want us to sanitize our
Here's
hands?
the more, I'm not gonna look at it. The more you treat this like a real thing,
Right. No, I was just determining on if you wanted like a whole video, like a whole interview, or if you wanted to just put, like demonstrate the skills. Like in.
you have a diagnosis of dyslexia.
Okay, so you can say I'm listening to your lungs or. Okay.
So for normal noises, if I hear,
And you're cracking your
this is what it
Thank you.
means. If I hear things.
Alright.
So we are supposed to figure that
So
out.
I have
Okay.
That's correct, right? Like it's your 80 valves closing at S4, it's not even closing
Is that comfortable for you? Like on the arms, the patient is told the blood pressure, the systolic level will be measured on their ankle. The PT will palpate the posterior tib pulse on the right ankle and the left ankle, and gel will be applied to that position.
Oh, your blood
You can still get a history of it and it be unrelated.
just introduce yourself and be like, I want my mom.
So where should I ask?
Yeah. Yeah. Okay. The only thing that's Tatiana scared is like all of her recanting face.
I don't know. I don't know. I'll see like how it's flowing. Ready? I had back pain. And all across my lower back.
To measure the right ABI, we take the systolic pressure found on the right posterior tib pulse and put it over the highest of the right or left arm systolic level, which was at 126 millimeters per mercury. The posterior tib pulse was measured at 144 millimeters of mercury, making the right ABI 1.14. Any value greater than 0.96 is considered normal. The left ABI is measured the same way as the right, using the left posterior tib systolic level. In this case, 136 millimeters of mercury was recorded, making the ABI 1.08, which is considered normal.
Well, like,
one way each way.
I am
and
Merbeth,
everyone
and I
rode
approve
where
of
they
this
had to have
video.
it walked off.